Shannon Doherty of 90210 fame is in the headlines right now talking about her battle with stage 4 breast cancer and with infertility. She talks in this article about how she was actually going through fertility treatments with her partner when she was diagnosed with breast cancer. When she was diagnosed, her automatic assumption was that the IVF treatment was linked to her cancer. And this led her to decline doing anything further in terms of fertility preservation before undergoing chemotherapy and treatment for the breast cancer. She said, "I believe that the reason I got cancer was because I did IVF." So let's talk about it. I'm Dr. Lucky Seekon, a double board certified OBGYN and REI, here to provide you with some reassuring information on what the data says regarding the risk of breast cancer after undergoing IVF treatment. Some forms of breast cancer are sensitive to hormones like estrogen and progesterone. So naturally, people have worried that doing IVF stimulation, which leads to a transient rise in your estrogen and progesterone levels that lasts maybe a week or two, could predispose someone to a higher risk of breast cancer. Now, here's the thing. We've been doing ovarian stimulation for IVF for now over 40 years. And so we've actually been able to accumulate tons of data. And the studies really don't show an increased incidence of breast cancer after undergoing IVF treatment. Something to keep in mind is that there are established risk factors for breast cancer, such as older age, delayed age of having your first child, or nulliparity when you haven't had children at all. And therefore, when you look at the data, there is an association between underlying infertility and breast cancer incidence in your lifetime. There have been several meta-analyses and systematic reviews, as well as studies based on registry data. Here are a few examples. This study was from the Netherlands, published in JAMA in 2016, and it included 25,000 women who have undergone an average of 3 to 4 IVF cycles with a median of 21 years of follow-up after they were exposed to IVF drugs. There was no significant difference in the incidence of breast cancer by age 55 in the non-IVF versus IVF group. It was 3% rate of breast cancer in the group that had undergone IVF versus 2.9% in the non-IVF group. Check out this meta-analysis published in Human Reproduction Update in 2014, pooling the results of 8 cohort studies with a total of 1.5 million subjects with follow-up anywhere from 3 to 16 years after patients were exposed to IVF medications, showing no increased incidence of breast cancer in those who had undergone IVF. Now, when I see these studies, I'm not surprised because when you think about what's happening when someone is going through IVF stimulation, the increase in estrogen and progesterone levels is so transient. It's really a matter of a couple of weeks. This is not like being on long-term hormone replacement therapy. It's also worth mentioning that we routinely will stimulate the ovaries of women who have an active diagnosis of breast cancer before they undergo chemotherapy, radiation, and surgery so that we can preserve their fertility. And oftentimes we'll use a drug called letrozole to keep the estrogen levels low. But this is something that oncologists are very supportive of, and they do not believe that this is going to significantly increase the risk to their patient, and it's a really important quality of life issue. So those faced with a cancer diagnosis shouldn't be afraid to undergo fertility preservation because we have enough data to suggest that this is something that's safe and worth doing. I want to finish up by saying breast cancer is extremely common. There's a 1 in 8 lifetime incidence for any woman that they could be diagnosed with breast cancer. This is why anyone with a strong family history, or if you're in your 40s, I'm always going to recommend having screening like a mammogram done prior to undergoing treatment, especially prior to getting pregnant, because once you're pregnant, that's 9 months where you're not going to have the ability to undergo treatment if you are diagnosed with breast cancer. So it could really delay appropriate treatment and it could change your prognosis. And for anyone considering fertility preservation, whether it's because of a cancer diagnosis or just to circumvent the effects of time, or considering fertility treatment because they have infertility, you shouldn't let the fear of an increased risk of breast cancer get in your way.